Hello everyone, this is Stephanie. I decided to make another wheelchair video for you all. I'm with Healthcare-Edu. You can find the links on the bottom, okay? So this skill will be assisting a patient out of bed to the wheelchair and a pivot technique. So take a note that it's a pivot technique, all right? All right. And so we're gonna assume that I've washed my hands. And if you haven't watched my hand washing video, go back into the checklist and find it, okay? So knock, knock. You always knock prior to entering. And now I'm going to announce myself. Hi, my name is Stephanie. I'm your CNA today. And I'm going to help get you out of bed to the wheelchair. Is that all right?
All right.
Okay. Can I see your two identifiers? All right, so that's the intro you do for every skill. And also I'm going to close our privacy curtain, all right? Some things are simulated, obviously, because I can't close the curtain so you can watch the video. So I knocked, I close my privacy curtain, I say my name, my title, I tell the patient, explain what we're going to do. All right. So what I'm going to do now, I'm going to deal with objects first. The patient's already in a sitting position, which is good. She could use the assist stand device, which is the side rail, but actually for a pivot technique, I'm going to bring the side rails down. Okay, I'm gonna bring the side rails down. And my wheelchair, let's see how we're going to do it here. You kind of take a look on how to position the wheelchair. It might not be perfect at first, but you make sure that you get it as close as possible. So I'm actually locking the wheelchair for patient safety. And notice I dropped my side rail, but I haven't gone far. Like, don't leave the room with the side rail down. I'm still right here. So my wheelchair is locked, which is number one. And what I'm going to do, I'm going to, for the safety of this skill, I'm going to take the footrest off. If you don't know how to use a wheelchair, make sure you watch my video where I show you how to lock the wheelchair and take the footrest off. So make sure you take off the footrest. A lot of checklists like Prometrics and things, they say you could lift it or swing it, but I say actually take it off. Okay, so let me try to figure out how I want to set it. So a lot of times you have to look at your body mechanics and the patient's body mechanics. So I have my wheelchair here. I have a gait belt. This is what a gait belt looks like, and we'll go over how to put that on. I have the patient's robe, which I'll use a Johnny. And what we're going to mimic, because our lovely patient here, we're not going to really take her socks off, are non-skid socks, okay? So at this checklist here, you could put non-skid socks on. That's another safety technique in order to, for the patient not to slip and fall. So now what I'm going to do, I'm actually going to use proper body mechanics, move certain things out of the way, and help get her to a sitting position, okay? So what I'm gonna do, remember we never tug and pull the patient's arm. So I'm going to reach behind her neck here. I'm gonna put two hands here. And so what I'm going to have you do, Louise, I'm gonna help you sit on the edge of the bed on the count of 3. 1, 2, 3. Okay, now it's a pivot. So what we're gonna have to do, can you scooch your bottom forward just a little bit? Don't stand yet. Scoot your bottom forward, plant your feet on the ground. Okay, so this is a good position here. The patient's feet's planted on the ground. And so what we're gonna do here is called a dangle, all right? I'm going to ask her 2 specific questions. Do you feel dizzy or lightheaded?
No.
Okay, and so it's not, are you okay? It's actual dizzy or lightheaded, because you wanna make sure she's not suffering from orthostatic hypotension, which is when someone goes from lying to standing and their blood pressure drops all of a sudden, okay? So now with the dangle method, you wanna give them about 2 to 3 minutes in order to, you know, get themselves calibrate. So what we're going to do is put the robe on. I'm actually gonna put your robe on. So remember, we put her socks on while in bed, the non-skid socks, just to be clear. So let's put the robe on, dear. All right, so, and I think there's gonna be a point, come around this side, but let's put this on. So now we have the inside tag. So the robe, we want it to be snug where one finger fits underneath, but not a tourniquet. So I'm actually gonna just bring this over. Lift up, please. I'm going to put it in a slide. Oh, let me just get it sorted out. All right, so it's snug. Now, if you notice, the buckle is off to the side. The buckle's off to the side. Actually, can make that a little bit more snug. And I can fit one finger underneath, okay? So that's kind of how it's supposed to be. If a woman has larger breasts or if her breasts are sagging, it's not supposed to go over her breasts. If she had some sort of abdominal surgery or something going on, it's not supposed to go on the abdomen. But all this information you should have on the plan of care so you know what to do. So now I do take a moment. It's probably been about 2 to 3 minutes. I ask, do you feel dizzy or lightheaded? No. Okay. So now I know I locked it. I'm going to get it a little bit closer. Make sure I just take a second moment to make sure it's locked again. And now here, I make sure I explain to the patient what's going to happen. So on the count of 3, and you could record, write these down. These are words you're going to say. On the count of 3, I want you to take both arms and push up. I'm going to help you stand up. Then I want you to take this arm and reach for this arm rest, okay? On the count of 3, you're going to push up. I'm going to help you stand up. And we're going to turn together your body. Don't take any steps. Take this arm and reach for this arm rest, okay? It's called a pivot. And basically, you're to turn your body without taking any steps, all right? So we're going to get real close to each other. Do you have any questions? All right, and I'll repeat it one more time. And you always want to make sure patients really know what you're doing, especially with transfer. Can you put both arms, okay, on the count of 3? We're going to stand up. You're going to push your body weight up. And then you're going to take this arm. You're going to reach for this arm rest. Are you all set? Yes. Okay, so what I'm going to do, I come close to the patient. It's knee, the patient's knee, and my knee. And I'm actually going to squat down. And honestly, with this bed, because this lovely patient's a little bit taller, you could actually make the bed. That's why you have to see the patient's body mechanics. Plant your feet on the ground, scooch up and plant your feet on the ground. Good, 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 good. You could, if the patient's taller, do you see you could raise the bed a little bit so you don't have to squat that low. All right, and so we're gonna count to 3. So I'm gonna come close. Again, I have my knee, the patient's knee, and my other knee sandwiching. I'm squatting down, and I think maybe if you sit on this side to see the, okay. So I'm squatting down, I'm squatting on the count of 3. And then when you stand up, you take this arm, reach for this arm rest. You good? 1, 2, 3. Stand up, reach. Okay, so that's a pivot technique. Now, once the patient's done, I think you might have taken like 1 or 2 little micro steps there, but you know, with practice, I unlock the wheelchair. And the skill's not done. Let me just say, we wheel her to our cafeteria. Let's just say, wherever you're gonna bring her, again, make sure you lock it. Locking of the chair is extremely important. And so you still can't leave her like this. You have to put the footrest back on. And so that's why you notice that you couldn't do it with the footrest on. So you have to look at this. This goes on the inside. So I think this is on this side here. Sometimes the footrests get a little tricky. So again, go back and watch my footrest video. When you're putting the footrest back on, be very gentle with your patient. That did lock into place because you don't want it to hit the patient or scratch the patient, okay? And working with the wheelchair just takes some practice. Oops. Can you lift up, please? Let me help you. Ooh. So I'm gonna drop this. There we go. Okay. There we go. And the last thing, I'm gonna take off my gait belt. You're all set. Let me just take off the gait belt here. Make sure, and if I wanted to put a bath blanket to cover her, and you always end up with your finishing up steps. So no matter where a patient is, they need to be able to call you. So here's your call light. Are you comfortable?
Yes.
Okay, there's no documentation required for this skill. The wheelchair is locked. The patient has the call light. The patient's comfortable. I will exit the room, open my privacy curtains. I will hand hygiene, and I'm done.